We're going to assume that a client has thoracic outlet syndrome going into the right arm, hand, and fingertips with numbness and tingling. Now, you want to start off by working the superficial pectoralis major muscle by softening this area so we can get into the pesky pec minor, which plays a crucial role in thoracic outlet syndrome. So here we're going to move the arm up as we stretch through the pec major, and we're going all the way into the anterior deltoid and preparing to get into the pec minor. Now, once you've done that, you can sit down, relax your body because this technique takes time. When the pec minor is tight, shortened, or overactive, it's going to compress the underlying brachial plexus and the subclavian vessels. So you're going to take your fingertips and you're just going to slowly sink in with a soft hand. You're going to support the pec major with the other hand, and you're not forcing anything here. The nervous system is going to be very irritated, so you want to make sure that you're just relaxing into this. Deep breaths in and out by the client as you slowly, gently kind of slide into that area. This is going to take time. Now, as you slide in, you're going to start to notice that you can feel the rib cage underneath your fingertips, and you can do some research to see if there's any trigger points or tender points in that area. You could also get the client to kind of squeeze their shoulder blades together. So they're going to squeeze the rhomboid muscles, and that's going to help to reflexively relax the pec minor. So get them to squeeze those together for about 10 seconds, and then that's going to relax the pec minor to allow you to work in a little bit further into that muscle. You can do this 2 to 3 times. So get the client to contract their rhomboids, move their shoulders down and back, and then work into the muscle a little bit more. You can even do a positional release where you bring their arm further over their body to shorten the pec minor. And then you can kind of go back and forth, and you're just looking to kind of soften and ease any tension or adhesions in this muscle with a really gentle pressure. Now we're going to work on the subclavius. The subclavius anchors the clavicle to the first rib and stabilizes the shoulder girdle. However, when there's excessive tension in the subclavius, it can restrict clavicular movement and narrow the costoclavicular space, which contributes to TOS. With reinforced fingertips, you're going to sink down and in just underneath the clavicle, and then you're going to create these little frictions, and you're just going back and forth and creating space in this area so that it can allow for a little more movement. You can follow that up by taking your fingertips and just going on top of the clavicle and getting rid of all the little adhesions over the bone. And you could even move the arm up and stretch along that area as you work through it. Our next stop is the clavicle. What you're going to do is you're going to traction the arm with one hand, and then with the other hand, you're going to move their head out of the way just to create space to do the technique. Then you're going to take the heel of your hand and place it on the clavicle. Now, as you traction the arm, you're going to do some joint play with the heel of your hand along the entirety of the clavicle by just mobilizing it and pushing it down. The costoclavicular space between the clavicle and the first rib is one of the key regions where compression of the thoracic outlet structures occur, so doing this technique can be really helpful. As you guys can see, I'm tractioning the arm, and then I'm keeping my arm straight, and I'm just using the heel of my hand to gently do some nice little joint mobilizations along that area. This technique kind of functions as a double whammy because you can actually traction the arm at different angles. So here I'm moving the arm up and I'm just doing a bunch of different tractions and mobilizations, which is going to open up space around the area. It's going to stretch the pec muscle, the shoulder. It's going to allow for more synovial fluid movement in the shoulder and in the joints. And this is just a really lovely technique that kind of further enhances relaxing and easing tension in that costoclavicular space. With a pincer grip, you're going to stabilize the wrist and the hand, and then you're going to do this little wiggle technique for the shoulder. This doesn't look like it does much, but people with TOS oftentimes are doing a lot of repetitive motions, and the shoulder is oftentimes going to be restricted, and the shoulder is a synovial joint. So you're going back and forth. You could also do rotation where you just kind of rotate the arm. You're stirring up the fluid. You're getting it moving and going. You're lubricating the joint, you're lubricating all of the areas around where we just worked, and you're really enhancing everything that we've just done. You could do this for a minute or so. You can even place your fingertips down just to feel the fluid and the movement, especially going into the anterior shoulder, which is an area that we really want to get that fluid going and moving. Now take a seat, relax, and we're going to work on the anterior neck. We're going to do some effleurage by placing our fingertips just behind the ear, doing some nice circular motions, and we're acclimatizing the client to our touch in this very sensitive anterior neck area before we go in and work on the anterior scalenes. After you've done a couple of effleurage strokes and you've warmed up the area, you can turn the head and then you could roll your fingertips down into the levator scapula, upper trapezius, middle, and posterior scalenes. And you're just going to pin them down against the first rib. And then you're just going to also, at the same time, as you pin and stretch that muscle, you're going to get the client to bring their head to the opposite shoulder. Hopefully that's going to allow for a little more space in the first rib. Then you can glide your fingertips down the side of the neck and create space and length in all of those muscles as you move the head to the side, which is going to be an activation style stretch. Now, once those muscles have softened and it feels like there's a little more length and circulation, you can turn the head to the side and then get the client to press up into your hand, and you're trying to locate the SCM. Once you do, you're going to slide your fingertip just behind it onto the anterior scalene. So you're going to do that on one side, and then you're going to find it on the other side by rotating their head. And now you have a rough idea of where that location is. Now, once you've identified it, you can get the client to take a deep breath in and out so you know you're on the scalenes. They'll move up and down. And then you can kind of just work the muscle just a little bit before you get the client to bring their chin towards their chest as you slide down those slender little cables of the anterior scalenes and stretch out those muscles. You can do this technique a couple of times, going down towards the first rib and bring it back up. And this is going to create some length in those muscles. An alternative technique is to do a positional release where you shorten the muscle around your fingertip by rotating their head towards your fingertip. Now, the scalenes are often tight, hypertrophied, and are involved with a lot of different compression of the neurovascular structures. So treating this area is absolutely key with TOS. Doing some cervical spine joint mobilizations can be really useful for someone with thoracic outlet syndrome, especially if they have the condition because they have forward head posture. So you're just going to mobilize the joints back and forth, moving the cervical spine. You can place some reinforced fingertips in the back of the neck and then move from the lower neck all the way to the top, mobilizing all of those tiny little cervical spine segments. This is going to help to reduce neural and muscular tension and improve forward head posture. Alternatively, you can also use your hands to kind of hold the head and then do a cervical spine traction that feels absolutely lovely. You can hold this for about 10 seconds, which is going to open up all of those cervical spinal segments one at a time. And then another alternative technique here is to place your fingertip pads on the suboccipital muscles just on the occipital ridge in the base of the skull. And then you can just pull back, which is going to traction the muscle. And once the muscle has a lot of stretch in it, it's going to work into the joints, and you're going to end up tractioning the joints as well. When you do this technique, you could hold it for about 10 to 30 seconds. You want to make sure to flush out with some effleurage and leave the client with a nice feeling of relaxation. We've done a lot of specific work here. So you're just working in, just doing some nice effleurage around the neck, the shoulders. You can get the client to take a couple of deep breaths in, and then you could leave them on the table for a couple of minutes just to relax after what is quite a specific treatment.